Well, good morning, everyone. And Bruce, to your point about people saying, well, what does that mean? What does that title mean? That's exactly what my parents said to me. When I called and said, guess what? The president-elect has asked me to be his domestic policy council advisor. They said, baby, that's wonderful. What is that? So thank you, and thank you for explaining that so well, and for your wonderful introduction. It is a wonderful honor to be here with all of you this morning and talking about, I was going to say one of my favorite subject, but it really is one of my favorite subjects because there's so many things that go into the agenda that will ensure that our children are leading and having the opportunity to lead the kind of lives that they should. And I really want to thank Bruce for all of his wonderful years of dedication and service to this set of issues. You are a true champion for children, so thank you so much for what you do. And I also want to commend all of you on the many endless hours that you all devote to these issues. And they're so critical because we have to make sure that our children, our very youngest children, thinking about them from the very, very first days, are able to go on and lead lives that will make them happy and productive and engaged citizens and able to compete in a 21st century economy. So as we gather here today and we're focusing on prioritizing the needs of children, we obviously can't ignore the fact that we're living in challenging times, and Bruce alluded to that at the very, very beginning. And we know that our state budgets are strained and constrained, and that every day that families are doing far, far more with far, far less. Yet in spite of these budget challenges, the administration remains committed to ensuring that children have good health care, that they have the education that they deserve, and that our nation is paying attention to the needs of children and our youth. We can't afford to leave anyone behind, anyone on the sidelines, if indeed, as the President often says, we want to out-innovate, out-educate, and out-build the rest of the world. We know that this is particularly important when it comes to our children. Our President has made it clear from the very first day in the White House that he wants to ensure that our children have hope for the future and that their hope for the future, in fact, turns into our hope for the country. If they aren't successful, our country can't be successful. We have to make sure that our youngest have a very solid foundation so that they can build healthy and stable and secure futures. Our President is so deeply committed to this because he hears daily from those families whose children are not receiving the high-quality health care and education they deserve. Parents who are worried that the achievement gap will widen instead of shrink, that a great education, a college degree, a good job, a satisfying job in a 21st century global economy, that those things are becoming less, not more likely. And he hears from both the uninsured and the underinsured, people who are worried sick about their children, and the fact that they might not be able to provide the kind of health care coverage that they need and deserve, and that's particularly exacerbated during these really tough economic times. And it is indeed true. I'm sure you've heard the President talk about these 10 letters that he reads every day, and he's not making that up. He reads those letters, and that's one of the ways that he touches and gets a sense of what's going on with everyday people just trying to live their lives, just trying to do the very, very best that they can. And he often comes up to us holding those letters saying, what are we going to do about this? And later on when we respond to him, he says, does this solution provide an answer to this person's particular problem? So to tackle these challenges, the President has laid out a comprehensive and fair vision. We have to be clear and we have to be honest, and he has done so, I think, in particular over the last few weeks as we've been engaging in this economic debate. We have to reduce our growing deficit. And in many ways, we have to do that for our children. But in doing so, we also have to apply the principle of shared responsibility. So as part of any deal that the President is working to try and solidify, we know we have to take on spending in domestic programs. We know we also have to take on spending in defense programs, in entitlement programs like Medicare, but we also have to take on issues with regard to spending in the tax code as well. We need a balanced approach that asks the very wealthiest and special interests to pay their fair share. We're talking about getting rid of tax breaks for billionaires and for millionaires, tax breaks for oil companies and hedge fund managers and corporate jet owners. Any successful negotiation warrants compromise, and there needs to be compromise on both sides. We have to tackle our budget deficit, but not at the sake of American values. And while we make these tough but necessary choices, we also have to make investments where investments matter the most. And investments in children are investments in our future and the future prosperity of our country. The health and well-being of our children, as I mentioned a minute ago, is a national priority. It has to be. That's why one of the very first bills, and I heard Bruce allude to this or mention this before, the very first bills that the President signed into law was the reauthorization of the Children's Health Insurance Program. And the Child Health Bill was an early down payment on the benefits that are being realized today because the President had the fortitude and the courage to fight for and eventually sign into law the Affordable Care Act. The ACA has already given Americans a lot of freedom and a lot of control over their health care choices, and it includes substantial new benefits for children across the country. Thanks to this law, insurance companies are banned from denying coverage to children because of a pre-existing condition. Thanks to this law, we are expanding regular home visits to needy parents in order to improve health, development, school readiness, parenting, and the prevention of child maltreatment. Thanks to this new law, all Americans who joined a new health care plan can receive recommended preventative services like well child visits and immunizations without any out-of-pocket costs. And thanks to this new law, new mothers who choose to nurse will be able to do so in the appropriate space and have break time at their jobs. I can't emphasize enough how badly we needed the changes that are being brought to fruition because of the Affordable Care Act. Going backward by repealing this law, and that is a fight we are literally fighting every single day, whether in Washington or some courtroom across the country. And efforts to repeal the law and prevent it from being implemented don't make sense and could bring real harm to our children. And finally, we can't confuse reforms that will make Medicare and Medicaid stronger and more efficient with those that will shift the cost of care to the most vulnerable among us, including our children, our seniors, and people with disabilities. In fact, just last week I met with a group of families who were saying to us, Medicaid makes all the difference for us in the world. Each of those families had a child, in some cases the child now an adult, with some form of disability, and they talked about the importance of balancing what the changes that were taking place in their states, the uncertainty to their budgets, and the uniformity and the stability that Medicaid provides to them. Those are the real lives, the real faces behind all these big numbers that we're talking about. And it's critical that everyone in our country understand these aren't just numbers, these are people. And these are people who are trying to do the very best they can for their children and for their families.